Hi, thank you for joining me today on our Instagram Live. I'm Hayley Gardner. I'm a licensed Chinese medicine practitioner and medicinary specialist here at Estuary Herbs. Today we have an acupuncturist joining us from Port Orange Acupuncture. Her name is Meaghan Sutter, and she is an incredible acupuncture physician, and I'm excited to have a conversation with her. How are you today, Meaghan?
Good. How are you?
Doing great. Thanks for joining us. I'm really happy to have you here.
Thank you for having me.
Yeah, absolutely. So this is Meaghan. She is an acupuncture physician at Port Orange Acupuncture in Port Orange, Florida. There's a little bit of contact information for her on the screen. You can follow along with that, and I'll make sure you guys have all of the information that you need at the end of this if you need to get a hold of her for any reason. I would love for you to just kind of start by telling us a little bit about your practice. Tell us a little bit about the community that you're in, kind of what the shape of your practice looks like, and we'll take it from there.
Okay. So I run a general practice in Port Orange, and it's located in the Spruce Creek Flying community, which is pretty, I would say, if you're familiar with the Port Orange area, it's pretty exclusive private community, but it's open to the public. It's a very unique, practice. Location because of all the airplanes that can come in and out, and it's pretty neat. But basically, I run a general practice, and I see mostly patients for pain, traditionally pain, sciatica, headaches, lower back pain, and just general aches and pains.
Mm-hmm.
And I've been in that location for about 11 years, I would say, since I graduated.
Wow, yeah, time flies, doesn't it?
So it's a pretty unique location, which makes the practice pretty special. So it's a very I would say a little boutique practice. So I
Yeah,
a specialized massage therapist with me. She's very good. She does a lot of therapeutic massage and specializes in vacutherapy and rapid techniques, and she does a lot of applied kinesiology. So between the two of us, it's pretty well rounded.
yeah, that's a really useful combination when you're working with a lot of pain patients like that. I imagine that that's a very highly sought out combination of techniques. I kind of want that right now.
Yeah, I like it.
Yeah, I know that you kind of came to Chinese medicine with a background in massage and acupuncture. I'm sorry, not acupuncture, yoga and different kind of manual therapies like that. Can you speak a little bit to how that's informed the shape of your practice today?
Sure. So I started in massage therapy back in 2003. I went to school in Key West. That was a great location and fun experience.
Yeah.
Um, just being a yoga practitioner for many years, I wanted to add a little bit and try to specialize in what I thought at the time would be Thai yoga massage. So I traveled to Thailand in 2000, I believe it was 2006, and I ended up getting sick, which I thought at the time would probably be a little bit of a culture shock. But my professor there said, "Oh, we don't go to hospitals, and we don't traditionally send you to clinics. So I'd like to send you to an acupuncturist." And I said, "Okay." So off I went. Sure. Within 3 to 4 treatments, tongue diagnosis, and pulse, they gave me my Chinese differential diagnosis, gave me some herbs, and within 3 treatments, I was feeling a lot better. So I thought, wow, this is something I can definitely expand on. So I would say, within a year of getting back from Thailand, I enrolled at FCIM. So
That's a really cool story. I
yeah,
love that.
it was
Um, wow, yeah, it's so cool when we can use our own personal kind of illnesses and just kind of healing journeys to bring us to the places that we can really powerfully help the people and kind of do our life's work. I love learning where everyone's come from and kind of how we all ended up where we are today. And it's almost always some kind of a, well, I was broken and it fixed me, and here we are kind of story.
parallel move. Massage is, well, most of us know, listening and watching, is very profound. It's necessary. There's a lot of different modalities with massage, and acupuncture, I think, just takes it up, just maybe to a different level of facilitation of healing the body. All modalities are necessary. We just have to find something that works for our bodies. And for me, acupuncture is definitely something that worked quickly with little to no side effects. And it was, it was a game changer. So I was excited to experience it, and I was excited to continue my education in it. So that was nice.
Yeah, it sounds like it kind of expanded your worldview a little bit to kind of understand a whole other, I don't know, just kind of expanded capacity that the body has to heal itself. Kind of talking about it just being taken a step further than what you'd experienced so far, and kind of working on internal conditions and things like that.
And as you are very familiar with, acupuncture, Chinese herbs definitely gets to, I feel, the root cause of a lot of illness, where we're not just treating symptoms. And we're so trained in Western medicine to treat more reactively than proactively. So I think, our medicine is definitely on the front line of mainstream now. And a lot of people are open to experiencing it. So, and the results, of course, are great, with very little side effects to no side effects, except more relaxed, better sleep, and so forth. So I noticed very quickly after my experience with acupuncture in Thailand how great I felt. And I couldn't pinpoint at the time, but while my digestion started improving, my menses started improving, my pain had reduced, and all from needles and herbs. It was nice.
Yeah, it makes you just want to dive in. Like, what is this magic? How do I do this?
Oh,
Let's figure it out, right? Spread it.
I was referring, I had a lot of inquiries from clients at the time of, I wasn't exposed to acupuncture and other modalities other than massage.
Mhm.
I was finding that I was referring out a lot. Wow, I can treat this.
Yeah.
Then that led me to, before I knew about acupuncture, that led me to Thailand, which led me to acupuncture. So it's kind of full circle.
Yeah, absolutely. Well, we're so glad that you're using this medicine, and I think that you've brought an incredible skill set and just huge value to our profession as a whole. And it's just so inspiring to talk to practitioners that are so on fire for what they're doing, and the help that they're able to give, and the education they're able to give patients to kind of facilitate those, aha, oh, my body can do that. It has that capacity. It just needs a nudge in that direction. Help me find that, to be able to give that gift to patients, I think is, I don't know, for me, the most rewarding thing in the world.
Absolutely. And it's, as you said, it's great to see their response, their body's response to not being having to have surgery or some sort of pharmaceutical intervention as well. So it's definitely rewarding. Definitely rewarding.
Well, and to that point, I'd love if you could speak a little bit more about that. We had talked before about some of like the biggest myths and misconceptions that we see coming into the clinic. And you had kind of mentioned something along those lines. If you could really pinpoint, like when your patients come in, just things that you see people believing over and over again about their health that you feel are kind of destructive or misconceptions, what would you say about that?
I would say the majority of patients feel that they're not going to get better, and there was definitely, unfortunately, a last resort. And I think they come in with a mindset of that they can't be fixed, or what ails them is normal for them, and they don't know what feeling better feels like. Uh,
Mm-hmm.
so I like to educate patients to let them know that there's different modalities that would be able to help them, and we're hoping that acupuncture will be the facilitator that will be the game changer for them. But I would say the biggest myth is that patients just feel that pain is normal. Oh, it's something I've struggled with. Oh, I've had it for 25 years, and oh, I only move my bowels once a week. That's normal. And it's great to see the change and to change their view with that.
Yeah, that's huge. I love that. That's something that I find myself repeating often as well, when talking to people, whether it's a patient or just someone who, wants to ask me about Chinese medicine or whatever. But oftentimes I find myself saying, just because something is common doesn't mean it's normal, right? Yes, menstrual pain is common. Yes, constipation, having a bowel movement once a week is common in our culture. That does not mean it's normal or necessary or helpful or, an indicator of health. And it doesn't mean you're stuck there, right?
Exactly. Yep.
But yeah, it's all about just kind of allowing the results to speak for themselves. I find for me in my variations of practice over the years, I really try to stay away from this energy or like mindset of convincing a patient that this is what they need to do, or a potential patient or anyone. I'm not in the business of convincing anyone of anything. It doesn't feel good to me. But I do always say, you're here and the results will speak to themselves. This is my recommendation. And, there you go. Like it kind of resolves itself after a while, right?
Health, yeah, exactly. And it's not a quick fix. Just like your pain did not occur overnight. I mean, acutely it could, but I have a lot of patients with chronic pain that they've
Mhm.
had, 20 plus years, or it's a combination of, internal and external pain, and their mind's disconnected from the body, and they don't realize that, sometimes a mind shift change can also help facilitate healing. And that's another thing that, I feel that acupuncture definitely touches on, is the mind-body connection. Um,
Mhm.
our mental and emotional health can definitely play a role with our physical health, vice versa.
Mhm.
One thing I would like to emphasize and stress is that I feel that we're more parallel with conventional medicine. I feel that, with a Western diagnosis, that we can treat Easternly, which definitely, Western medicine is absolutely necessary. I feel that we're just an adjunct to that, and very complementary. So when you go into an acupuncturist office or an herbalist office, I do feel that it brings a lot of question into people's own health, a lot of things they didn't think of before, because as we're very detailed with our intake forms, and a lot of connections they didn't make with their body and the healing and so forth. So that's, I think, very important with the acupuncture. And then I think, as far as convincing, I think they think about themselves and how, oh wow, I never made that correlation before. I'm going to go home and think about that. And the next thing you know, the pain's dropped, two to three, two to three numbers.
Yeah.
Yeah.
Yeah. And they come back and they're excited to keep going.
Yeah. This is
Absolutely.
great. This is, I feel so good. I have more energy. I slept better last night. My bowels moved. My headache's gone. It's great. I think mind body awareness is super important.
Absolutely. Yeah. One of my favorite moments that kind of connects to that idea, when I'm talking to a patient and they kind of have given me this, or a practitioner that I'm working with to do herbs, or whoever, but I kind of get this long, it just feels like a long grocery list of symptoms that the patient is kind of looking at as disconnected, because maybe they have their GI doctor that is dealing with this symptom, and their cardiologist that's dealing with this symptom, and their foot doctor that's dealing with this symptom, and they're all these separate things, and people sort of internalize that and start to think like, oh my gosh, I have so much going on. Like I'm hopeless, I'm broken. And I keep using that word because I hear it often. It's reflected to me very often in practice. And one of my favorite things to do is to just kind of take all of that information and assimilate it and kind of piece it together within the framework that we have, that Chinese medicine has so eloquently given us, and kind of say, okay, well, actually, all of those things that you're currently viewing as disconnected are all under the category of, for example, spleen qi deficiency. That's what's going on. That's the root of all of these different things: the bleeding disorder, the loose stool, the fatigue, the mind fog, like all of that. They're not separate. The muscle weakness, like all these things, they're part of this one system. And people, even you can kind of get into those little minute sort of subclinical symptoms that the doctor doesn't really want to hear about. They don't seem significant at all, but we can speak to that because nothing is subclinical in Chinese medicine, right? We care about all the weird stuff. And people say, oh my gosh, that makes so much sense. It's just that like moment where it makes sense. Suddenly their body makes sense to them, and they're willing to tune into it and like pay attention and look at it rather than dissociate because it just sucks, right?
Right. Yeah, that's the downside of when you're dealing with a lot of specialists, is that what's so great about acupuncture and Chinese medicine and herbs is that we do facilitate and look at the whole body, and we can piece things together. And yeah, it's pretty remarkable. It's pretty remarkable.
It really is.
a lot of doctors, are, they don't have a lot of time, and sometimes just telling your story will make you feel better.
That's so true. Absolutely. Because again of that mind-body connection.
Right.
To me, that speaks to this concept of Shen that we have in Chinese medicine, right? That like kind of cognitive, mental, emotional, spiritual piece that is sort of that like spark of life in the body that you can't really describe, but when it has a space, when it's given acknowledgement and kind of brought back into like the physical symptoms, things start to shift. They start to like have space to transform. It kind of comes to life in a different way, you know?
Exactly. Yeah.
Well, I'd love to ask you a little bit about kind of your relationship with herbal medicine and your practice and kind of what that has looked like historically. I know that you and I do a lot of work together these days, but maybe tell me a little bit about what your relationship with Chinese herbs were prior to working with estuary herbs.
Pretty much zero. Chinese herbs is very ambiguous, I feel, for a lot of practitioners, and especially for me, it wasn't a specialty of mine. I primarily focused on food therapy, Chinese medicine, or acupuncture, yoga, and a little bit of the patent herbs. So patent, for those of you listening that aren't familiar with, is basically a very general diagnosis for a wide variety of pain. So when we have patent herbs, you could just take the little bottle of pills, and it's very effective, and that's what I used for years. Um,
Mhm.
and then when Hayley opened Estuary Herbs and reached out to me regarding compounding formulas and custom formulas, and her background in classical Chinese medicine, I was very excited because that was the component that was missing in my practice. So she's very proficient in Chinese herbs, and I definitely recommend that, if anyone wants to reach out to her regarding compounding formulas and custom formulas, or just general questions about herbs, that she's definitely your guru in that practice. So I feel that your company has really opened a big door to Port Orange acupuncture, and has really completed our circle with acupuncturists and Chinese medicine.
Aw, thank you. I appreciate that. That's very kind of you. It's been a joy working with you guys. I feel like I've gotten to know some of your patients in your practice and a lot of that over the years. And it feels really, really good to be able to just provide a boost. You know, sometimes I know you and I have had conversations before about, this aspect of treatment is responding very, very well to acupuncture and the dietary therapies and the changes in, physical modalities. But there's like maybe this one piece that is very internal that needs a supplement, that needs to kind of have that herbal piece. And it's really fun collaborating and kind of connecting the dots of what you're seeing and what I'm seeing and how to bring that together. And it's been fabulous. I've enjoyed working with you guys so much.
I've noticed is that even though patients are coming in with very similar symptoms, formulas can be completely different, and diagnosis can be completely different. And hence, a lot of the reason why I have just a general practice and not specializing is because so I don't want to exclude myself to anything, because there's so many different aspects to healing and pain, and I just love the variety and the challenges. And I think the herbs has definitely, put us on top in the area with being able to provide that service. So that's nice.
Awesome.
Yeah.
Yeah, I agree. I think that's something that is really interesting about Chinese medicine, Chinese herbal medicine, but also acupuncture. Sometimes someone can come in with back pain that might look to, I don't know, a doctor that is focusing on pain conditions or something like that is the same as the back pain next to it. There's no obvious structural cause, things like that. But from our perspective, we might have three different patients in front of us with back pain that is not structurally related, and they might be from three different types of conditions. One could be blood stasis, one could be kidney yang deficiency, one could be spleen
Phlegm.
deficiency, phlegm. Yeah, we had one of those. All kinds of exciting things. But yeah, the formulas are very, very different. And I think that does come back to your point about that Chinese medicine differential diagnosis, and really kind of understanding, hey, well, what's the underlying thing that we're doing here, rather than and sometimes patent formulas, like you were mentioning, do have a place. They're super convenient. They're really effective when they're like on point, right? But they're kind of more of like a broad spectrum type treatment. And for some conditions, like we have to focus more in order to really get to the root of that.
Yes.
And it's nice to have all of those different like tools in your toolbox, right?
Yeah, it is.
Let's see. And well, tell me a little bit about, I know that you work really often with our over-the-counter formulas. Tell me a little bit about how that's kind of worked in your practice, how that goes for you.
Well, they're great because they're on hand. And, if a patient that's not open to doing a custom formula or doesn't have or doesn't want to invest in a long-term plan, the over-the-counter formulas work very well. So I find that the concentrate, it's a bonus to have it an 8-day formula as opposed to like 30 days. Find that patients are more compliant to take it. It's more convenient for them as well. So I have the majority of your over. I believe the over. Haley's wonderful, and she keeps changing and adding things, which is nice. Variety, especially your new seasonal herbs. I find that what you've done with your over the counter has really helped my practice, and it touches with everything from constipation to bladder to body pain to sinuses and allergies, and it's nice to have on hand, definitely, because even patients that I'm not currently seeing with acupuncture will call and say, hey, do you have that breathe free my sinuses? I was like, yes. Yeah, so
Love that.
yeah, it's a great formula, and your descriptions are wonderful. So
Thank you. Yeah, that is that was kind of that line of formulas. I think there's like 13 original ones, and we kind of are adding new ones all the time when the need arises. But the inspiration for these formulas all came kind of from my, time in general practice, and just wishing like, oh my gosh, I keep seeing the same pattern over and over again. And I'm making, because I had my custom pharmacy there, so I would make the formula, but it's like one-offs, making the same formula over and over again. Like when patients come up with sinus stuff or whatever, it's just kind of a more generalized treatment. You're like, I don't have to reinvent the wheel every day. I could just have a bottle and I could just hand you that. Somebody could call and say, hey, my kid's sick. Like, okay, we got you, and just have something to give them. It gets really time prohibitive in practice, as I'm sure you're aware, to like, just have to be kind of stopping the acupuncture side of things and shift into the pharmacy side of things and create the formula and deal with the, getting it to the patient when they can just kind of come grab something and have it be a little more hands off.
yeah, and I'm very familiar with your line, so even other practitioners in my office can say, oh, breathe free or lemonade, this will work for you as well. So it's nice.
That's really wonderful. Well, is there anything else that you are interested in kind of sharing with us about your practice, or things that you'd kind of like to describe to anyone that might be watching today about who your ideal patient would be, the kinds of people that you really like to work with, who tends to be a really good fit for working with you as an acupuncturist?
I think just in general, anybody that's open to trying acupuncture and herbs, I think it's a great alternative and complementary to their current regimen that they're on. We work definitely with acute pain and acute symptoms, but if you have anything chronic or lingering or something that just hasn't been resolved, then I would encourage you to stop by Port Orange Acupuncture. I'd be happy to talk about and give you options and ideas that might help you, and know that your body could definitely heal. You just have to find the right facilitator to do that for you, and hopefully acupuncture and herbs is something that we can help with. But yeah, I just change your mindset to know that you don't have to be in pain all the time, and even if we can't get you out of pain 100%, 50 to 40% reduction is great as well. And then over time, I think your patients, once they open up those meridians and channels, I think they're going to start to see more healing. So
Absolutely. Yeah, 40% improvement can be life-changing for someone in chronic pain sometimes.
average, if someone's been in chronic pain or has any structural issues that are not able to change, or the doctors say there's nothing more we can do for you. Neuropathy is a big ailment that ails people. Again, I deal with a lot of sciatica lower back pain, and even those unusual cases that you feel that anybody can address or help with, then I would definitely encourage you to keep your options open to alternative healing. So.
Yeah. And I would add to that and try to reach out before it's your last resort, because the earlier in that pain process that it can be intervened upon, and you can start having this kind of varied tool set to work with and kind of learning about your body from this Chinese medicine perspective, Meaghan can really help to facilitate that education piece and giving you tools and lifestyle modifications and things that you can do earlier on that's going to help to make that a much larger percentage, or kind of a larger chance to get the profound healing that you're looking for and pain reduction.
Absolutely. That's actually one of my favorite things to do is I love to educate patients on just listening to them with the first intake, and allowing them to speak their story, tell their story. And then even if sometimes I'll sit for a half an hour to an hour and just listen, and then I can, ad lib some things that they may not been aware of or open to. And usually, proactively more than reactively is the best approach to health. And if something's off, your body's telling you that. I really would encourage people just to listen to their body, and to know that if you do have pain, or you do have a chronic headache, or something that feels out of sorts, that it's your body telling you to pay attention to me, do something. So if it's not life or death, I would definitely encourage acupuncture to be your first resort.
Yeah. And if it is life or death, go to the doctor first and then come get acupuncture.
Yes.
Yes, absolutely. Well, Meaghan, this was super lovely. I really enjoyed talking to you today.
Thank you for having me.
Yeah, absolutely. I'd love to do this again sometime and just kind of check in. I really want to keep this being a regular kind of conversation, and just kind of bringing up different topics on the point of patient and also practitioner education, and just kind of making those connections, and, kind of helping to bring us all back together. I think, especially over the last 2 years, everyone has been a little disconnected. The world has been a little weird. I don't know about you, but I definitely have started to feel like I'm on an island in this practice at times, and connecting with other people, fighting the good fight feels really good. So
we're here to help. We're here to help. So thank you.
Absolutely. Take care. Have a lovely rest of your day, and I'll talk to you soon.
You too. Thanks.
Thank you guys for joining us today. It was wonderful to have you. I really appreciate you coming and listening to us chat. And I will have this, all of this information up so that you can find Meaghan Sutter at Port Orange Acupuncture if you need her. I highly recommend checking her out if you're in her local area. And I hope you have a wonderful rest of your day.